Okay.
You start with you over there.
Thank you. Councillor Louise Gibbard, Cabinet Member for Care Services.
Councillor Wendy Lewis, Wenaloedd Ward.
Sandra Joy, Uplands and Bryn Mel.
We're just letting a couple of people in at the moment, so hopefully. We're locked in, they're locked out. Sorry, I can only apologise for the hiatus, but everybody's now in, so that's good. Sorry, Jane, we're down to you, aren't we?
Hi everyone, Jane Whitmore, Strategic Lead Commissioner for Social Services.
Jane.
Hi all, Mark Gosney, Commissioning Team Leader.
Hi everyone, I'm Dave Rossiter, another Commissioning Team Leader.
Hi everyone, I'm Lindsay Margetson, Principal Officer for Safeguarding, Performance and Transformation.
Hi everyone, my name's Alison Mathias. I'm the team leader for the Service Quality Unit, so that's the independent reviewing officers and conference chairs.
Julie Davies, Head of Child and Family Services.
I think you've already done it, haven't you? And obviously, on my left, I got Liz and myself. Accident, but most people probably know that anyway, so that's fine. Item 1 on the agenda. Oh, sorry, I should welcome everybody, I suppose, first of all, as well. I'm very pleased to see all the officers here, as well as members. We've got a lot of members here for once today, so that's very good. I'm pleased to see that, and we haven't got many apologies. So, on that basis, I'll move straight on to apologies. And could we have your apologies, please, Liz?
We've received apologies from Councillor Mike Day, Alison Anthony and Hayley Gwilliam, Chair.
Thank you, Liz. Item 2 is disclosures of personal interest. If anybody's got any interest they want to declare, this is your opportunity so to do. I can't see any hands going up anywhere. So we'll move on to item 3, which is the prohibition of whip votes and declaration of party whips, which is always on the agenda, as you well know. Item 4 is the minutes of the previous meeting. Everybody, all the members have had a chance to have a look at them, had a chance to read through them. I don't tend going through them page by page, but if you've got any queries or any comments, please take this opportunity, so to say. And if you haven't, then we'll approve the minutes. And again, I can't see any hands going up, so everybody seems to be happy with it. And we'll move on to item 5, which is public question time. I don't think we've had any, Liz, we? So we don't have any as such, so we'll move on straight away to item 6, which is the update from the Regional Safeguarding Board. So I assume, Dave, that you're going to take this here. And
yeah, if I may, Chair, apologies for not being in the room. I'm full of cold,
okay.
so I didn't want to come in and infect you all. Yeah, the report before you is the Regional Safeguarding Board's annual report. This report goes along with all the other regional boards' annual reports, are submitted to the National Independent Safeguarding Board, which is then charged with providing assurance or not to Welsh Government and the Minister about whether the multi-agency safeguarding arrangements in place across Wales are effective or not. So that report basically sets out the objectives of the regional board and then details some of the work undertaken by the 4 key subgroups, which you'll see referenced in the report, which focus on undertaking on behalf of the region case reviews when there are specific concerns about the way a particular child or vulnerable adult has been supported through the safeguarding arrangements, carries out those reviews, which then make recommendations back to both the board and to individual agencies. So basically focuses on learning from those cases. There's another there's another group that focuses on policies and practices, so making sure that the various multi-agency policies that we need to have in place across the region are kept up to date, or that new policies and procedures are implemented, you know, as safeguarding our understanding of what good safeguarding practice looks like develops over time. So that group focuses on ensuring those arrangements are in place. There's a training subgroup, which does what it says on the tin. That focuses on making sure that the multi-agency training that's in place for us, both for agencies, but importantly that covering that multi-agency element of training, that all that training is in place and being delivered. And then the final group is focused on performance. So it's those subgroups really that are the engine room for the board. All of those groups have representation from across the partnership, and for our purposes, importantly, have appropriate representation from Swansea Council officers. You'll see from the report, generally, I guess I characterize it as three out of the 4 subgroups, you know, good evidence of progress against the expectations and objectives we'd have for those groups. I'd probably caveat that a bit for the 4th group. I still think it's a bit of a work in progress for safeguarding boards, not just our safeguarding board, but for safeguarding boards across the piece, as to quite how you bring together performance reporting across that complex landscape. You know, we know, or I hope the committee recognises that we have good performance reporting on children's services within the local authority. Similarly, in local authority in Nipper Talbot, amalgamating that information with the information that's available in other organisations, and then trying to make sense of that as to what does that mean? What does that tell us about the effectiveness of how we operate as a safeguarding board and as safeguarding partnerships? That's more tricky. There is some national work that's been underway and has come forward with some recommendations around how boards should do that. But at the moment, it's still the case that I think that we're grappling with that. Having said that, so having caveated of whether it's as good as it needs to be, and recognising that there needs to be some progress moving forward, for the information that is available to us, you know, good work is coming out of that subgroup, and identifying areas where we perhaps have issues within our communities, or issues in terms of how we might progress being the best that we can be as a partnership. It's that area that most obviously would strike to me as area where we need to make more progress, I'd say. What's also contained within the report is quite lengthy reports from individual agencies and organisations about their contributions to the work of the board, and their focus on safeguarding as you know, as organisations in their own right. There's some good and detailed feedback from that. Probably say, from my perspective, perhaps the report isn't quite there in terms of how do we then make some judgments around, well, if you bring all of that information together, what does that tell us about how we overall, how effectively we're working as a partnership, as opposed to just being reflections on how our individual organisations performing in their own right. Nevertheless, it's good that that information is there, and there's certainly a lot of rich information. I think one of the areas that is an objective of the board going forward, where we probably haven't made as much progress in the past, but we're starting to see some progress now, is the extent to which our population of children and adults and families, etc., are actually contributing to and driving the agenda around safeguarding in our region. And we're starting to see that there are some initiatives that have been taken forward that are starting to progress that agenda. So I'd bring your attention particularly to the work of the Junior Safeguarding Board that's now been established. And you'll see within the report that they've done some excellent work taking forward matters and issues that young people have identified are important to them. So that's good progress. You'll also see some other examples referenced in the report around I can't remember what it's called now, the PAN network. Can't remember what PAN stands for, Parent Advisory Network, or something like that. Julie might correct me. Where that's work that parents who have been involved in safeguarding and child protection processes are becoming advocates in their own right around how we could improve those approaches and systems going forward, again, to be the best that we can be for parents and families and children who are caught up in the child protection system. So that's some evidence of progress against that particular objective of the board. Other than that, I think probably my final comment would be, Chair, that the board continues to function effectively with good representation from all of the key partners, both the statutory partners and other stakeholders. So we have good attendance at the boards. We have good representation in the various subgroups, albeit I think for all organisations in the current climate of the amounts of pressures that there are on all of our day-to-day business, and the pressures that we're all having around workforce sufficiency, bits of it are creaking at different times. And if you dug into some of the detail, you'll see that some of the subgroups report that at times they've had difficulties with maintaining consistency of membership on the subgroups. And whenever we don't manage to have consistency, that tends, consistency of participation and attendance, that tends to slow up progress with driving forward the objectives and the overall work programme. But overall, I'd re-emphasise the board continues to be well supported. It continues to manage, its key and core business well. And as we've reflected at different times, whilst the systems within children's services within our organisation is under considerable pressure, we still we still in the main always manage to maintain safe and effective services, and that continues to be my overall view, but with that caveat that we're probably under across all of those safeguarding public services, we're probably under the most pressure we've ever been. That's it from me, Chair, but I'm happy for Julie to add anything as a member on the board if she wishes. Otherwise, happy to take questions.
Thank you, David. Julie, did you want to come in? Okay. Certainly the report, David, is comprehensive, and I'm sure everybody in the room has read through it word for word. I must admit, I did go through it in detail. I got some detailed questions, but I don't think I'll go into that at the moment, to be honest. Certainly, I was a little bit concerned when you were saying that you're not really that satisfied with the way the safeguarding board is actually working at the moment, and is not perhaps as effective as it should be. You will recollect when we go back into history, back to 2009, safeguarding board wasn't working then when we went into special measures, and one of the things that came out of that was very much Right. Now, something that came out of that very much was the safeguarding board was re-established, particularly working with the chief executive here and the chief superintendent at the time of the police, who was Mark Mathias. And they put that in place and it became a very effective force from a Swansea point of view. Then the regional board was established, and we expressed our concerns at that time that we were losing the Swansea safeguarding board. And as a result, the chief executive at the time, Mr. Straw, put in place, I think it was called the Public Protection Committee, basically to make sure that the safeguarding that was being done previously under the safeguarding board was carried on in Swansea. I don't think that's effective so much now, but from what you're saying about the safeguarding board, is not purely effective. It's not totally effective at the moment. So it does raise concerns about us getting into a situation where we were back in 2009, potentially, if we're not very careful. So I don't know if you have any comments on that.
Yeah, I mean, just if I go back to the history, you're right. There were concerns about the effectiveness of the Swansea Safeguarding Board. At the same time as we obviously had significant concerns around children's services in Swansea. The chief exec did it along with Chief Inspector Mathias, establish a public protection board. It didn't replace the safeguarding board, but I suppose it looked more widely at not just the effectiveness of children's safeguarding, but wider public protection issues. When the safeguarding board morphed into the regional arrangements, when Welsh Government changed the policy infrastructure around creating regional boards rather than having local boards. You're right, there was a concern around would we lose something around the robustness of our oversight. Not sure if I intended my caveating around a particular element of the board as being an indicator that perhaps we've returned to a period where we had significant concerns. I think it's a very, very different set of circumstances we have now. Our own oversight of our own safeguarding performance as a council, particularly focusing on children's services and adult services, that's so much more robust than it ever would have been in the past. So I think if the kind of concerns that we experienced in the past were to re-emerge, I think you as a performance committee and your equivalent in adult services would be well cited on that, well in advance of anything emerging in the way that it did in the past. Not sure I'd be relying on the safeguarding board to take on that responsibility for us. They are another mechanism where I suppose we're tested and challenged around what is our individual performance as well. I think the bit that I was trying to emphasize is it's quite difficult to translate the individual performance of individual statutory organisations and others and amalgamate that into evidence of whether you are effective as a partnership. We have good evidence around individual performance of individual organisations, including, importantly for us, Swansea Council, and then in Swansea Council particularly our safeguarding performance in children's services, our safeguarding performance in adult services. We have individual information from the health board, lots of it contained within that report, about how they're performing as an individual organisation as well. Likewise with the police, likewise with some of the other partners. It's how you turn that individual evidence of performance into I suppose a more simplified analysis of what does that tell us around what difference we're making as a combined system effort. And it's not just us that are struggling with that. It's not the case that we'd have done that much better in the past when we were Swansea Safeguarding Board. It's just a difficult thing to do. And I think all safeguarding boards are grappling with that. Hence, I think that national piece of work around how might we do that better. And when that advice comes forward and we move into implementation of specific recommendations, our board will adopt that approach as well. And I think that will produce something different. But it's not to make up for it's bad now and we're going backwards. It's an acknowledgement, I think, that we could do it better as a multi-agency partnership and as a region, as could all other regions. So I don't want you to take the wrong impression, Chair, that I'm really worried about that. I think I'm flagging up an opportunity for improvement that I still think we need to make.
Okay, David, thank you for that. And I think certainly those of us who've been involved all the way through would recognise the vast improvements that have been made in terms of child and family services and the way it performs since that period when we were in special measures. I will ask members if they've got any questions that they would like to raise with David at this time. I'm not seeing any hands going up anywhere, either in the room or on the screen. So it looks like you might be getting off light. I could keep you here for another half hour, but I'm not going to do that. We might well do it outside sometime, David, but that's another matter. Certainly, from my point of view, it is what you say, it is the importance of the department itself in terms of safeguarding as far as Swansea is concerned. The safeguarding board has got a contribution to make to that, but for the reasons that I think you've already explained, we really need to be more dependent on ourselves and on in the board in terms of making sure our children and older people, for that matter, are properly protected. I don't know if anybody wants to add anything to that. If not, I'll say thank you very much. Sorry. Was it? No. Oh, Sue, did you want to come in?
Yes, if that's
Sorry,
possible.
Sue.
No, I'm having problems getting the hand to raise and on my computer. Just something that was on the news today regarding the increase in safeguarding issues that are coming through to the council. Have we got a big problem with the numbers of safeguarding problems that we have within the city and counties of Swansea?
Julie, do you want to pick up for children?
Yeah, I read that article with interest. I think what I would say for Swansea Child and Family Services, we're not seeing the same volume that they're seeing in, I think Bridgend was particularly quoted. It's not unusual when there's been serious incidents in a local authority area for partner agencies in particular or anybody actually to be making more referrals into child and family services. We're not seeing necessarily a significant increase in the number of referrals and contacts. What we are seeing in Swansea is an increase in the level and range of needs that families are presenting with. So what that means is that there's more intense input required and people may stay open with us for longer and the level of intervention may be higher. But numbers wise, no. The situation still prevails in terms of difficulties recruiting qualified social workers. But as you know, Swansea has got a clear plan in place to overcome that through our own Grow Your Own models, so supporting our own staff to become qualified social workers, which we'll see the benefits of in the next 12 to 24 months. So I think it's fair to say from my perspective, and hopefully Dave would agree, that the picture is not the same, it's different in Swansea than is presented for the authorities that are quoted in that article today. But we would concur with the challenges around recruiting qualified social workers, but we do have plans in place to overcome that.
Thank you, Julie.
Yes. I think the other point in terms of safeguarding board, which I was going to make, David, in that sense, is obviously there are areas in terms of safeguarding, particularly in terms of drugs, etc., where we need to be working very closely with some of the agencies. That's where I think the safeguarding board probably should be putting their efforts into ensuring that coordination is working in that area.
Again, it's part of the challenge for us, and that you're right. The safeguarding board, clearly needs to have an interest in the how we are responding, collectively towards the challenges that our population have. There are other boards that are more closely involved in the actual work that's taking place. So the area planning board has a responsibility for making sure that we have effective both prevention and treatment services in place. The community safety partnership has so Safer Swansea for us has a responsibility around again the impact of substance use, the links with criminality and exploitation, as well as what we're doing in terms of driving forward public health approaches, etc. The Public Service Board has established the two public service boards have established joint oversight of that work in particular, and specifically have requested that the APB commissioned an independent drugs commission for us to get independent expert advice around the improvements that we need to make to services and systems to best support our population. What the safeguarding board does is seeks assurance that all of those arrangements are both in place, but over time are making the difference that we need to make through a safeguarding lens. So I'm more confident at this stage that we've got good arrangements in place to make progress, but we're right at the beginning of making progress. So at the moment, that remains a very concerning issue for us in this region, both the rate of drug deaths, but also the wider harms that's having for our population. And there'll certainly be times when Julie and her team are talking about the difficult work that they're involved with to keep children and families safe, where problematic substance use is one of the factors that's impacting and contributing to that contextual harm that children are subject to.
Okay, David, thank you for that. I'm sure it's something that we'll be keeping an eye on ourselves going forward. So we'll, as I say, we will watch that with interest to see how that develops, to see where we're going with that. Okay, any more questions, David? No hands going up, I can see. In that case, I will say to you, David, thank you very much for the presentation. I was going to say whiskey's good for a cold, but you're probably better off sticking to paracetamol. I better not recommend anything else to you. Okay, thank you very much. So if I can move on to the next item on the agenda, which is the Service Quality Unit Report. Who is going to present this, please? So it's Lindsay then.
No, it's
Oh, I got it mixed up.
Sorry, Chair. I'm
Alison.
the team manager.
Sorry, Alison, my apologies.
That's okay, no worries. So you've all had a copy of the report. It's not my intention to go through the full report. What I'll do is I'll highlight some of the key findings, the child's voice and the service priority. The report covers from the 1st of April 22 to the March 23, and it covers the performance of the local authority from the perspective of the service I work in, which is the Service Quality Unit. The Service Quality Unit, along with children and young people, come up with a service vision. And the vision we have is having someone just for you who listens, supports and understands you, so you have a voice. And that covers both the service of the independent reviewing officer and also the child protection chairs. So some of the areas that we, as a service, we feel are working well is that regional partnership working continues to take place with the National Youth Advocacy Service, and that we try to capture information to make sure that our children in both CP and LAC are offered advocacy. You can see from last year there's an increase from the uptake of the service from 11.91 to 1608. And that we have regular conversations with the social workers and the IRA CP chairs in relation to conversations about advocacy and independent visitors to make sure that children are aware that they have a right to take up this service. We have, in conjunction with the participation officer, held participation events with children and young people to understand what matters to them, and will take and they take place regularly through the year. So we take learning from that, and then we're currently going through a service review. We use that information then to make sure that we are improving services for what matters to children and young people. Swansea is active in involving care experienced children in appointing new staff and to help build their skills. And one young person who recently interviewed with us said that he's never interviewed or offered somebody a job before, and it made his year. 90% of our children and young people have a voice and were involved in some form of their LAC reviews. The team have been creative in their thinking, and 4 of our members of our staff are working in a different way. So they are the legislation tells us that we need to record information about children's care and support plans and discussions around that. So these 4 members of staff are actually writing letters to children and young people about what happened in there, or what was discussed in their meeting, what was agreed in their meeting, and how that's going to be taken forward. Swansea Save for all our care experienced children, and this year we saved 123,350.71 pence this financial year, which went over to the Share Foundation for our children when they turn 18, so they can draw money down. When a child is between the age of 15 and 17, they can do the Step Ladder Plus scheme, which they can earn an extra £1,500 a month. £1,500, sorry, into their pot of savings, and that helps them with 6 stages, which helps them with their financial. Are they able to pay bills? Can they, do their consider what type of things they need to do when they turn 18 with regards to their budgeting. Cocker House this last year was redecorated and developed and is much more child and young person friendly, and it's now a place for staff to be able to stop and utilise or dock there for them to do their work, or even to have it for meetings and invite children and young people in there. The IROs are maintaining the Welsh Government standards with regards to getting their recommendations out within the 5 working days, and also their minutes of their meetings. All Swansea care experienced children's reviews are held in venues of a child or young person's choice. And that's sometimes in Cocket, in school, in their home, where they live, where they'd like that meeting to take place. Our care experienced population, as does our child protection population, remained stable over this financial year. Every conference, a questionnaire has been provided to partner agencies and to families to help them share with us their experiences in conference and what they think that we could do better, or what we can learn from, or what has helped them through that process. And that information then is shared and helped develop services. All Swansea child protection meetings were held in person in Cocker House, and families tell us that this is something that's really important to them, and that they like to be in a room with people for them to be able to have that conversation. we were successful in having 16 young people attend their child protection conference meetings and be part of their plans. We ensure that all our paperwork captures the voice of the child and the views of parents who have responsibility. And that we, within this year, within the year that we're talking about, the Born into Care information and research, we, as an authority, decided to work with families a lot sooner than we normally would in a conference process. And we've been successful in having some children whose names didn't go on the register when they were born, because the social workers and the team around them actually worked really robustly with families to prevent that happening. So that was really positive and a really good outcome for families. What some of the challenges are is that our IT system, which is WICAS, continues to be a challenge in supporting data and capturing data. That even though we've increased advocacy and independent visitors, there's still lots of work needs to happen for us to make that and understand a little bit better why that's not being taken up and what we can do to capture that information. A small number of meetings were held out to timescales. We had 8 LAC reviews within the 12 months and 5 conferences. And some of those, there were reasons there. They were late referrals, no reports being available, and conference wasn't correct. For us to hold a conference, we have to have 3 agencies present. We've had some challenges with the WICAS system not being able to capture some of the health plans that we have sent to us by our health colleagues, and that that information then isn't available for when we have meetings with children and young people. Our IT system for collecting data on personal education plans only takes account of the ones that we receive in timescales. However, within the last week, we've developed a much more robust system with education for us to be able to make sure that we are able to capture all the personal education plans we have for children. Some IRAs have limited time due to the increase of volume of work set out by the IRA standards and the codes of practice. Young people tell us that they don't see or co-produce their care and support plans. And again, this is something that we're working on as an authority in relation to putting children and young people at the heart of their plans for them to be able to help us develop a new plan going forward. Young people tell us that they want information via technology and social media and hubs and other forms of communication rather than paper. Not all partner agencies, namely the police, attend child protection conferences. They are only partner agencies at the moment that we have that don't attend in person. But I believe that there is a plan in place for that to move forward within this financial year, and that hopefully we'll be able to see them in person. They attend via Teams. Child protection re-referrals have increased. So there's ongoing work is required to dip sample case closures to check the contingency safety planning is being developed with families when we deregister them. So if obviously, when they leave our service, any worries arise, then people know what they need to do for them to be able to follow the plan and help support the family. We worry that the safety plans developed within conference, including the danger statements, and are not reviewed within the core groups. And on times there, we found that, the plan comes back and there's no change. And we had a meeting today actually to look at how we can drive that forward, how we can review that, and how we can support practitioners for us to be able to make sure that is something that as a team that we can take forward. So those are just some of the key findings that came out of the report. I take you then to the children and young people's voices. Some of them told us that I've never seen my care and support plan and I've not contributed to it. I use my mobile phone every day. Why can't I have information given to me in in a hub or on an app rather than a leaflet? My reviews are scheduled when I'm in school or college and I miss out on activities. Can they be, can can they be organised outside of this time? And one young person who wrote to an IRO who was turning 18 said, "You have greatly impacted my life in a way that not many people could do. So I'm really grateful for that. After all, you're my biggest fan." And he said that because she used to always say to him, "I'm your biggest fan." So, you know what I mean? You know, we can work things together, because what we find in the service that we are is that, you know, there's quite a consistent turnaround of social workers. However, as independent reviewing officers, we have more stability within that, and they tend to be in children's lives a lot longer. And then if I just take you to the service priorities at the very back, which we've linked to the corporate parenting pledge. So we chose 4 priorities, which are for all our children and young people. We want them to get the same life chances as others in Wales. For all our children and young people, we want them to learn, develop, and help them become who they want to be. For all our children and young people, we want to ensure their views, feelings, and ideas are integral to our service and that they influence our service development. And for all our young people, we want them to have permanency and a safe place to live. I'm be happy to answer any questions, or I'm sure Julie or Lindsay would, if anybody has any questions.
Thank you, Alison. I know, Louise, you want to say something?
Yeah, thank you. I don't want to repeat what Alison said, but just wanted to thank Julie, Lindsay and Alison and the team for the comprehensive report, and obviously all the work that the team do on an ongoing basis. I hope everyone agrees that it's a very positive report highlighting some really good practice, as Alison's pointed out. And and very good feedback has been received on the work of the unit from external bodies as well, like Care Inspectorate Wales, when they we were part of their rapid review. And Alison also mentioned the Born Into Care, which I think has been highlighted as good practice externally as well. So it's really good. Obviously, clearly some challenges still to be met around the IT systems. We're aware that more children and young people want their voices to be heard in the process. And I think, we're doing a lot of work around that, and, trying to capture, contact them in the way that they want to be contacted, like through social media and things like that. We talked a bit in corporate parenting boards about, because we've looked at this report there as well. So apologies to Wendy and Sandra, who've had it twice, about how we can improve the uptake of things like advocacy and in the independent visitors and things like that. But it shows that that is moving in the right direction. Obviously, the team has not been immune to the staff recruitment challenges that we sort of see across the directorate, definitely. Obviously going to have an impact on the IRO team and etc. as well. So again, just my thanks to the team and to the panel for taking the report.
Thank you, Louise. I will throw this open to members of the panel now. If you've got any questions that you'd like to ask of Alison or Louise. Yeah, you're obviously satisfying people. Oh, sorry. I wasn't looking at you, was I, Sandra? My
That's all
apologies.
right. I can't imagine what it must be like to be a child going into care for the first time, because not only are they surrounded by this whole range of new people, but the paperwork must be phenomenal. And often these are children with significant literacy issues and so on. You talked about 4 of your staff perhaps writing letters to the children, and I'm sure they're in user-friendly language, but even something as simple as maybe putting that on some kind of recording for those children as a starting point, notwithstanding the IT issues that you've got. And I wondered whether you've thought about doing more orally with these children, so that they have got a record of it as well as in writing, and that there's a summary there for them.
Yes, Sandra. So as I said in corporate parenting board, we're going through a service review, and interestingly, we had the first feedback today of a young person who actually has her information written in a letter form to her, but she wanted the IRO to go out and to tell her and remind her after a meeting. She comes to a meeting, but she wanted her to go out and remind her after the meeting what was discussed, what was said, and what people, who needed to do what to help move her plan forward. forward. So most definitely, yes, we're capturing that data and that information with all our young people going forward in this service review, in the hope that we are able to then, meet the needs of what matters to them most definitely.
Thank you. I think that is the critical bit. They often, I know from experience, they sit in meetings and afterwards they are so overwhelmed. It really does need somebody to either sit with them and go through it, or even if they had a recording, not of the meeting, but of the summary points, they could pick at them when it suited them and be able to go back over it. And also, in the nicest way, hold you to account to say, you said you'd do that.
Definitely.
And I said I'd do this.
Yeah, definitely. And it's a
Yeah.
very good point and it's something we'll take forward. But one of the
Yeah.
questions within our, within our questionnaire is, who is the person you'd like to share the information with after your meeting?
Yeah.
And some of the ways that we don't write to all our children. Some of our children are much younger, the age of 6, 5 or 6. So we tend to do what they like if they're into princesses or kings, and we'll do a little bit of a spider diagram for them to visually know who's doing what and what was talked about as well. But most definitely there is something that we can definitely look and take forward and explore that option.
And I do appreciate that's notwithstanding your workloads. Yeah.
I'm looking to see if anybody else wants to come in now, because I'm conscious that I missed Sandra. No. Why do you think the levels of advocacy, the rate of take-up is so low? Is there any reason for that?
I think there's lots of reasons.
Right.
Some of
specific
it
then.
is sometimes that when it's the child protection conferences, we need the parents' consent to offer that to the child, or he has to go via the parents. That's different sort of context. For looked after children, sometimes it's about them understanding the benefits of advocacy and how that could help them, and what that would mean for them. So we are working with our commission provider, who's NIAS, to help us understand different ways that we could communicate that to looked after children, either through their independent reviewing officer, through the person that they live with, or through other people that are important to them. So I think there's probably different ways that we can, and people that are in the room who are commissioning that, as well as Alison, might have a view, but we are trying to be creative in and listening to children and people and what they think about it. So we are on a journey of improving the take up, and I think there's something about, for a child, it's another professional in their life, and if that really is not for them, then we need to respect their views on that. But the important thing is that they have a trusted adult that they're confident is able to represent their views for them when they're not happy with what's going on. And that trusted adult might be somebody that isn't in that professional circle, but we need to know who that is, and that's who they trust, basically. So, yeah.
You could argue I've been a bit critical there, but you could turn around and say, well, you did increase the rates by 50% last year, so that's not bad. Pardon? But that's one way of looking at it, I guess. I picked up somewhere about pathway plans. And I wasn't too happy about, but finding that page now is page 111, I think it was, in terms of the report. Pathway plan reviews were a small, only about 50% of the reviews of the total number of children. And I was just wondering why, if there was a reason why that is the case, or are they not looked on an annual basis? You were talking about 250, I think, with about 480 children on the.
Yes, we've got the total number of LAC review children, which is above the figure, and then the total number of pathway plans held during that year are the children who are 16 plus within our service. So they are additional to that, to that figure. Yeah.
a specific, it's like a subset of that.
Yeah.
It's not, it wouldn't apply to all of
No,
That's a bit of age.
But when they reach a certain age, when that by the time they're 16, basically their care and support plan is converted into a pathway plan. It's just a different language in legislation that it turns into something that reflects their road to independence, really, a pathway to independence.
I probably should have known that, but there we go.
Just talks a little bit more about like their independence, about like, you know, where they're going with regards to university, how are they managing with their money, where is their, you know, their plan for post 18 going to go. Just focuses a bit more.
Okay, thank you. I'm looking to see if there's any more questions. And I'm not seeing any, so thank you very much for the report. It was interesting. I've had a good look at it. And I want to say, Alison, is thank you very much for the presentation. Thank you. I'll now move on to the next item on the agenda, which is the Commission Review Progress Update. Are you going to take us through that, Jane?
Yes, Chair, if I start, and then will be a joint effort. There's 4 of us, and I know Claire's joined us on screen. Claire's the Principal Officer for Commissioning and Care and Child and Family Services, and has joined us on the screen as well. So between the 4 of us. Yes, I promise I won't talk for the whole of the session. So just in terms of the paper, you've just given us we've just given a paper in terms of an overview of our approach to commissioning, which is across the directorate, but this is specifically for how we work together with Child and Family Services. A little bit of context in the beginning shows about how much money we deal with and how much of the budget that actually goes out on it to externally commissioned care, which is that's core budget. There's also the additional grant budgets that go out to commission sort of preventative services as well. So it's really important that we do have a really clear and consistent approach to commissioning services in terms of making the best use of that funding and the best outcomes for people and for children. So the big thing about commissioning is it's the process in which services are planned and purchased and monitored. It's not procurement. So a lot of people will get them confused and say it's just about the inner cycle. So on the page under section 1, we've given you the analyze, plan, do and review cycle of the IPC, which is commonly used, that sort of describes all of the different elements that you will need to do to understand what services you should be commissioning to have best outcomes for children and their families. And then the procurement bit is the inside of it. So really important to understand that it is much broader than just buying stuff, isn't it? It is about understanding how you get those best services for our children and families. So we've all undertaken some IPC training recently across the directorate in terms of a consistency, so that we all can work together in a much more way, and our residents and citizens of Swansea can understand kind of what we're trying to do in terms of our commissioning approach. It varies from what kind of cohort you're working with, but it's sort of underpinned by those really good quality engagements and participation. We've talked a lot about voice already, and children's and families' voice. That's really important to understand what matters to them, so that they're informing our commissioning decisions as well. Understanding data and information, and what's the data telling us. A lot of the data you'll see for commission services will be in the general child and family performance report, but understanding what does that look like, and then how can we effectively work in partnership with other people to make sure that we're not duplicating, that we're working together to add that cohesive sort of joint working in terms of providing services. So just a little bit of an overview in section 1, and then section 2, that we just give you some kind of highlights of our current commissioning priorities and projects that we've got underway. And Mark's going to take some, and then Dave's going to take some, and I'll bring Claire in then, if that's okay, Chair. Thanks, Mark.
Thanks, Jane. Yeah, thanks all. So obviously the range of services commissioned across child and family are extremely diverse, everything from play to services for care experienced young people. You know, most of them are in different areas and you know, different aspects of the commissioning cycle. So obviously some are looking to be reviewed or recommissioned, whereas others are in the evaluation monitoring stage. So right now, the current priorities that we are looking at, we're currently reviewing the additional learning needs or those with disability contracts. That's the preventative services for children and people and their families with additional learning needs, or those with a disability. Obviously, there's a greater demand than supply in that area at the minute. So we are working with parent carers and children and young people to assess, what are the needs and how we can best meet them. We've got a workshop tomorrow, and then we'll have a previous one in next month as well. We've got 35 parent carers attending that, alongside colleagues from social care and from education. The next priority currently that we're working on is the Preventing Youth Homelessness contract. So that is being recommissioned. That's funded via the Youth Support Grant. And again, we'll be having workshops with young people in schools, and also young people accessing the centre-based system outreach to and their families to build up a good picture of what the actual needs. And then the next priority we have is reviewing the entire Children and Communities grant. So that is an amalgamation of a number of grants, including Childcare and Play, Families First, the Out of Court Parenting Support Grant, Promoting Positive Engagement for Young People at Risk of Offending, and the St David's Day Fund. So again, lots of different agendas, lots of areas of that is included. So we have just started that now. So we'll be engaging stakeholders from internal for the council and external in the third sector, etc., to look at the effectiveness of that and how to plan that, especially given the obviously challenging financial climate going forward, and as Kai's mentioned earlier, the needs that are rising in a number of areas.
Thank you, Mark. And so sort of following on from Mark, where some of our work overlaps, but specifically within my area at the moment, the therapeutic and assessment framework is part of our commissioning focus. We've done some really strong co-production work supported by our participation officer, Josh Price, which has helped us to develop the way that we've approached the commissioning and the way that we want to involve providers in that. This is done at a time when we are increasing investment in the internal therapy service, and so it's particularly important for us to balance what we can provide internally with what we are perhaps then forced at times to go to the market for, and to make sure that we find an appropriate balance that meets the needs of our children while trying to sort of rationalize what we can provide in-house and therefore have a better or a different sort of oversight of. As Mark has just described, we have a very joined up approach to commissioning amongst ourselves and regionally, where, as with the example of advocacy earlier, we are the regional lead for that sort of commissioning and contract management. The work that we do is inherently involving the people that are affected by services as much as possible, taking a strengths-based approach and ensuring that the services that are coming out of these processes are very much focused on the needs of the young people and families who are going to be accessing them, and the outcomes that are most important to them. One thing that under my side of commissioning, which does cover more of the sort of operational and care commissioning services, one thing that's been done recently is an update to the market stability report, which looks at how we balance our duty to provide sufficient opportunities for young people to be in the right care placement at the right time with what's available to us in the market, and how we need to respond to that as an authority in developing our in-house provision while utilising external providers where that's necessary for children's needs. Alongside that, back in, I think it was March time maybe, we also developed a fee paper which went to CMT, the corporate management team. That was another tool that was vital to us in being strategic in how we approach the commissioning of care services, in managing the cost of living crisis, while also trying to continue to ensure market sufficiency for our young people, and making sure that fundamentally we have the places for our young people, but that we're not paying more than we should for them. I think that sort of summarises most of the reviews that we're taking, and back to Mark for the last bit.
Thanks, Dave. Yeah, As James mentioned earlier, commissioning is often confused with procurement or assumed as just contract and grant management. We take a sort of much broader, more innovative approach in Swansea. We do look at gaps analysis and things like that. It's not just about giving money out or spending money. It's also about how can we strengthen the market, and we do this via, as Dave mentioned, a strength-based approach and a partnership. We're not just coal commissioners, where we see ourselves as a partner within the sector as well. And we look to support those that we contract with and those that we give grants to in order to deliver the best possible service for children and people and families. As well as that, we look at how we can income generate and look for different funding streams as well. Examples of that recently, we've worked with our colleagues in CMET, which obviously support the contextual agenda that Julie and Dave mentioned earlier, and we were successful in getting a funding application from the Youth Endowment Fund from the UK government, UK funding, sorry. And often when there's been reactive funding, we've been able to react quickly, but sometimes a consideration is whether or not we should be delivering things on a short-term basis, because the criticism is often it just goes. So in Swansea, we do try where there is good practice, where we have delivered things that have met the outcomes that Dave mentioned for children and families. So one example is the Summer of Fun funding that happened in Welsh Government funding back in summer of 21. We've enabled that to continue. We actually gained a second year of that via doing a video evaluation of our work in Swansea, which Welsh Government was able then to release more funding nationally. And they said one of the reasons that was the data and the evidence that we provided from Swansea, but also as well, and we've got other sort of funding from things like Shared Prosperity Fund, and we've worked with our colleagues in Tackling Poverty on the Tackling Holiday Hunger as well. So we do try where we can to maximise opportunities and work with partners and look to bring income in, because as I said earlier, it's a challenging financial climate that we're facing. We are facing higher needs in different areas, especially ALN and mental health issues and that. So it is about how we can get as many services out, particularly prevention services, to help with statutory colleagues as well. So the more prevention services out there, the better.
Thanks, Mark. I don't know if I want to bring Claire. Do you want to come in? Just like this, no.
Yeah, no,
Sorry.
so it's fine. Thanks, Jane. I was just going to add in relation to the therapeutic and assessment service framework that we're currently developing in child and family. I think that's a really imperative framework that we're developing. It's a framework for therapeutic intervention and assessments, just to ensure that services that we are commissioning are of a really good high quality and are cost effective, and are also outcome focused. Whilst we have our internal therapy service within Swansea, it's realistic that that team is not able to meet all of the demand of the children and young people that require that therapeutic intervention. So that's something that we are leading on currently, and hopefully will have similar success.
Thanks, Claire. And I think that just to summarise, I think it's really diverse. It was quite hard for us to pull it together of all of the different things that's going on, because they are interlinked and they do work together. But it is quite a broad picture. You go from one sort of to one end to the other, but actually they all have a really important part to play. So we continue to do the best we can with the challenges we've got. But and a lot of this work is starting out. But happy to come back with some further work in the future once some of the reviews are taking some traction. I'm happy to take any questions.
Yeah, I just wanted to add again my thanks to the commissioning team as well for their hard work bringing money into the service. But as you said, it's not just about shipping it out, but identifying what are those gaps, who is best placed to deliver the best outcomes for children and families across Swansea in that ongoing process. So thanks again.
Okay, thank you for that. And I got to congratulate you on the way you delegated all that, Jane. It was very good, very impressive, I must admit. I'm going to have to learn lessons from that, I think. Any members got any questions for the commissioning team? I can't see any hands going up. Can't see anybody in this room asking. So it seems like you've got away quite lightly on that, but perhaps because you explained it that well, I suspect. But having said that, of course, you will recall, I think, when we were looking at the budget last year, I did ask you about commissioning and how effective we are in keeping the costs of the services under control while making sure we're delivering services that people want. Is that that's the right way to put it, isn't it? So do you want to say anything to that?
I thought you wouldn't forget about that one. Yeah, absolutely. So in terms of how we monitor the spend as well as the services, because it's really important to take the two together. And there's some things that we have to do, and sometimes the spend is out of our control because we have no choice. And where we do have a choice in terms of getting best value. And I know the commissioning teams work really hard about negotiating prices with suppliers and providers, and actually making sure that we do get the best value. It is monitored really quite closely through our PF&Ms in terms of grant spend and core spend, because it is such a high area of spend. So it's probably some of the most volatile, and use that as the statement, is probably monitored on a weekly basis. So I know that Dave, in terms of the independent placements, and is actually that there is a really strong link with the finance teams. We've been looking at it today actually in terms of what does that spend mean and how can we forecast those really high areas of going forward. In terms of the grant spend that goes out the door, we have to report back to Welsh Government on how we're spending the money, and they scrutinise us quite often with which sometimes those reports don't really tell us what we would want to know, but we have to do it to secure the money. But which is a little bit of a frustration, but that's that's what we do. And of course, in terms of monitoring spend and understanding where we go in terms of forecasting for the future years, we know that there are huge challenges in some of the grant budget envelopes because they are flat. And obviously we've seen the announcements from Welsh Government about clawing back in year. So that's not had a detrimental impact on anything that we've been talking about or that we're doing at this minute in time that was committed. But we are worried and working forward of what does that future budget envelope look like, and how do we go around designing things that don't just drop off, that actually there's a good spread of everything in terms of that continuum of need, and what do we need to do. So I'm not sure if I've answered the question. Hopefully I have.
Yes, indeed. Thank you. I said, and having said that, the other element, of course, is that you are providing services via in commission. Presumably, you take every opportunity you can to talk to clients in terms of their requirements as well.
Yeah, so obviously we commission services a part of our contracting and things like that. Will be involving beneficiary service users, things like that within the commissioning and contracting, and also it's a part of the contract going forward in terms of the projects that are being delivered, ensuring that their feedback is involved in not just the listened feedback, but involved in service, planning going forward. And go back to the best value question as well. Often we look at best value, look at budgets, but we look at the finances and the data together, because best value can mean service delivery as well as and ensuring that people are meeting the outcomes that are important for the children, people and families as well. So you need to look at the finances and the data and that evidence at the same time in order to achieve that.
Thank you. I think, as with Mark, to perhaps try and answer both of those two questions at once, if I can. On the one hand, in terms of meeting the needs of our young people, for my side of commissioning, which is more operational and around care and support services, it's vital because that is a young person's home. That's their day-to-day experience. So getting that right is an absolute priority for us. We are developing as a team to try and work more effectively to achieve that. We also work very proactively with the market to make sure that where we identify trends in changing needs, where things are increasingly complex or more difficult to find the right support for locally, that rather than accepting that, we work with local providers and where possible in-house to develop the necessary skills to keep children as close to Swansea and their families and their natural links as possible. And in terms of managing the costs in the previous question, one of the ambitions that we put forward in the fee paper earlier this year is to work progressively and proactively towards the Eliminate agenda, which is sort of fairly set in front of us in 2027, in terms of eliminating profit from care services. I hope not the other way around. And that's something, you know, we could be passengers to that, but here we would rather be proactive and work towards minimizing profit today and making sure that services are sustainable, but you know, effective and not costing us more than they should.
Thank you. I think the not-for-profit element in one sense is causing certain problems, which I think we touched on previously at the last meeting. So I don't know whether there has been any response in terms of Welsh Government in that respect, in terms of what was being said and what you said was going to be said, I think, at meetings, Louise.
Yeah, I can't remember where I was last, but I think I recently had cabinet members network meeting with the minister, and this was on the agenda, and they the minister and some of the civil servants involved, and I think they said there's a working group at the moment looking at that definition of what not for profit is and what will be the exceptions that you know, because obviously in all cases we want to work in the best interest of the children and young people, so and moving them just for the sake of, you know, for somewhere that they're happy, so they is not the best option. So yeah, I think there's not a lot of progress, but they told me that the work is going on in the background, so hopefully we'll have a bit more clarity on that soon. Don't know, Julie, if you've got any other insight that I haven't.
No, it's fair to say that we still don't know from Welsh Government the detail of what a not-for-profit model would look like, and I think there won't just be one model, but in the absence of information, it's making some providers a little nervous, a little reticent, either in terms of staying in the market in Wales or expanding or developing their provision in Wales. So it's what that means for us is that then the choice for children becomes more limited. So when we focus on outcomes-based commissioning and the market is the level of fragility and instability in the market is growing, it makes it very challenging for us to always meet the entire range of needs of a child, particularly locally. So then we look further afield, so that we're still facing the same challenges, and we're still waiting for confirmation from Welsh Government as to the details, so that the providers know whether or not they're able to meet those requirements and therefore remain registered with Social Care Wales.
It's an interesting concept. It really needs a fair bit of consideration, I think, to get it right, because obviously you're struggling as a result of it, and it's a problem. Anyway, that's your problem at the moment then, is it? Yeah, okay. Anybody else got any questions that they would like to raise in terms of commission? Very quiet. Thank you very much for the presentation. Thank you very much for the way you answer the questions. It's always interesting to watch commission, I must admit, but that's another matter, I suppose. There must be some sort of anorak in that respect. My apologies for that. Anyway, to all the officers who presented here today, thank you very much. Really, if you would like to leave now, you're very welcome so to do. Although I have to say, we're not going to be going on much longer, I don't think, at this stage, because we've only got two left on the agenda now, which is basically our work plan. Members will have seen that. We're not intending at this point in time to change it at all, unless you've got any comments that you want to make in terms of changing it in any way or adding something into it. And I'm looking to see if any hands are going up or in the room. Julie.
I guess just for completeness, for the next meeting on the update on the improvement programme, Gemma West has left and Lindsay will
Okay.
Just replace that with Lindsay's name and the job title. I'll email you separately with, is that okay?
Okay, thank you. Okay, nobody's indicating, so I'll say on that basis to officers, thank you very much for coming along. Thank you for your presentations. To members, thank you for listening and contributing as well. So thank you very much. I'll close the meeting.
Yeah, thank you, everyone. Thanks.
Gavin,